Today we've had the Big Tent event for Surrey Downs Health and Care, where we got all the teams together to discuss the fuller stock take, but equally what we did was we broke up into groups to discuss different sections of how we can actually implement it.
There are a series of activities that get people thinking and talking about how we do things, what we might change, how you think about things like quality, risk, etc. But it's coming really from our staff, not from management.
That's massive, because I can bring what I've learnt from my experience in what patients are telling me and the difficulties I'm having in a day-to-day working environment, as are the rest of the staff, and we can bring all that and say, what can we do? What can we do for the whole population?
We are all here for the residents, and it's from them that we need to hear from first, so that we know what improvements we're making, or the things that we think will be improvements, or what they want.
And thinking much more holistically, so it's not just a medical problem, because it's rare that we just get a single medical problem without some social background or some mental health background. Usually it's a whole multifactorial problem, and now we've got the tools to try and get the right person in from the team to look after that patient best, and that's kind of the way we're trying to look at it.
These events are really important for us to sort of meet and introduce ourselves, especially like me in my new role. Not everybody will know me at this point, and with the pandemic and only meeting over Teams, it's important that you can open up communications quite well.
We can achieve a lot through Teams meetings and remote working, but there's been nothing like coming together, and I do agree we've seen that real energy and that innovation again coming through today.
We all want to do the best we can, and actually I can feel the energy in that room, and I can feel that everyone is on the same wavelength. Everyone wants to work together, and everyone sees the bigger picture.
People are really hungry to know what has worked in neighbouring PCNs, what's happening in a particular acute setting, and that just sharing of information is really going to accelerate what we can do across the whole place.
So particularly we were talking with somebody from social care this morning, and it was really interesting hearing how they evaluate, how they deliver services to their residents, and just do things differently from health. So it's getting that different perspective.
And what we found is actually, why work in silos when actually we can work together? We've got limited resources, we can work together and actually bring those resources together for the better of our populations and our colleagues.
What I love is us as a team, and I love how we collaborated. Everyone, the PCNs, the social services, everybody comes on board.
For me, it's a game changer really. It's really supportive of managers and to be able to do our job successfully. I think they should do more of them.